Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, the all-consuming power of an invisible disease.
I couldn't wrap my head around the fact that every day this urge showed up and just took all my power, and I was just lost. Something that you can't even see had so much power over me.
But first, the common misconceptions about arthritis.
It's really a misconception and really a mythology that wear and tear is a cause of arthritis. It's not. And there are multiple studies now that show that exercise actually keeps joints healthy.
All that and more this week on In Good Health.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
If you've ever thought about getting into running, you've probably heard the warning that it will destroy your knees. People fear that the high impact of the sport will cause wear and tear, putting you on a fast track to osteoarthritis. Well, I have good news. That's all a lie. Dr. Thomas Buchheit says this myth stems from our early understanding of the difference between rheumatoid arthritis and osteoarthritis.
Rheumatoid arthritis is known to be inflammation that's just out of control. And osteoarthritis, because it wasn't as inflammatory, was thought to be, well, it's just a result of too much wear and tear, too much weight, other things that drive joint damage. But it turns out it's just not true. And there are multiple studies now that show that exercise actually keeps joints healthy. There have been a lot of studies looking at walking and brisk walking that is good for arthritis pain and actually is good for arthritis cartilage.
Buchheit is the director of the Regenerative Pain Therapies program in the Duke Center for Translational Pain Medicine. He dives into our body's natural healing processes in his new book, Healing Joints and Nerves, Immune Stimulation and the New Science of Regenerative Therapies. Buchheit believes we've wrongly villainized inflammation in an effort to treat osteoarthritis.
After the wear and tear hypothesis kind of started to wane a little bit in its popularity, people started thinking, well, maybe osteoarthritis is an inflammatory problem. So let's do things. Let's use lots of anti-inflammatories like NSAIDs. Let's do steroid injections to suppress the inflammation. We can also use these powerful rheumatoid arthritis drugs that strongly suppress these inflammatory proteins. And it turns out none of that works. None of that works long-term to improve the health of the joint. They work short-term to suppress inflammation and improve pain. But actually, sometimes they're doing more harm than good.
We all know the typical protocol after a sprained ankle: rest, ice, compression, and elevation. But new findings show that this go-to method may actually be the worst thing to do for healing. The dangers of chronic inflammation have wrongly influenced how we react to short-term inflammation.
Chronic inflammation is nearly always bad for us. It damages tissues, it drives arthritis, it causes chronic pain. But the challenge is a lot of us have kind of thrown out the wheat with the chaff here, and some inflammation can be very good for us. Acute inflammation, short-term inflammation can be very good, and it's necessary for healing. For instance, if we have a cut, a sprain, or a fracture, we need inflammation to start and promote that healing cascade. And one of the challenges is that we've gotten so used to suppressing all inflammation with anti-inflammatories, with steroid injections, that we're turning off a lot of these natural healing mechanisms.
Studies have shown that people are more likely to have a faster recovery from injury if they have a strong inflammatory response. Sometimes patients with joint problems are given steroid injections to reduce pain by getting rid of inflammation. Unfortunately, this only provides short-term relief. A 2017 paper in JAMA tested this over the course of 2 years by injecting one group of participants with steroids and a second group with saline every 12 weeks.
And those who had got the steroid injections really weren't any better off pain-wise. Not a big surprise, because most of us know that steroid injections tend to do short-term improvement, but not necessarily long-term. But those who got steroid injections actually had less cartilage in their knees. So in fact, we learned at that moment that these frequent steroid injections that a lot of us were using to treat arthritis pain might actually be worsening the problem we were trying to treat.
Buchheit and others in the field realized they needed to rethink how they're treating osteoarthritis by reframing how they viewed the condition. Instead of treating it as an inflammatory problem, Buchheit began to think of arthritis and nerve injuries as chronic wounds.
A chronic wound does have inflammation, but you don't suppress the inflammation to treat it, right? You treat the wound, and then the inflammation gets better as the wound heals. And as we start thinking about it and thinking of the therapies, how do we heal a wound? How do we heal a sprain? How do we heal a joint? All these mechanisms kind of come together. And that's what I like to talk about in the book, is how our built-in healing mechanisms we are really needed to treat things like conditions like osteoarthritis, and how to kind of enhance our natural healing mechanisms.
Instead of fighting inflammation, we need to figure out how to resolve it.
Fighting inflammation is we're taking a medicine or having a drug that shuts off our natural immune process. Resolving inflammation is we're actually doing the opposite. We're turning on our body's own healing mechanisms. We resolve inflammation with exercise, which is inflammatory when we exercise. As a matter of fact, if anybody goes out for a high-intensity workout, they're going to be achy probably afterwards for a day or two. We all kind of know that feeling. And those are those immune processes, those healing mechanisms that are getting turned on.
The benefits of exercise are twofold. First, the mechanical movement enhances tissue nutrition by boosting blood flow and increasing waste removal. The second benefit is that the short-term inflammatory response turns on proteins called cytokines. While they're often blamed for causing excess inflammation, exercise stimulates a certain type that promotes healing.
So you have spikes in cytokines. For instance, IL-6 can go up 100-fold after exercise, and that's a known cytokine associated with chronic inflammation and everything else. But that spike of IL-6 will turn on all these downstream natural systems that resolve inflammation and strengthen us. A lot of, even in the exercise literature now, people are starting to refer to this cytokine, IL-6, as not a cytokine anymore, but an exerkine, trying to rebrand it as it's good for us, and it is good for us. And so we need that stimulus.
Which is why taking an anti-inflammatory before a workout impairs that tissue rebuilding process that should happen after exercising.
So we need that stimulus. The next part of exercise, though, is it also releases these tiny immune particles called exosomes. And exosomes are kind of instruction manuals for cells. Exosomes will teach a cell how to behave, and they'll actually reprogram how cells behave and can make them more youthful. So our bodies release exosomes with exercise, and those exosomes can improve tissue health also.
Buchheit calls this process the healing cascade. Ideally, the injury attracts white blood cells to the area to clean up and prepare the injured region, which is when inflammation occurs. Then, other immune cells come to repair the damage and resolve the inflammation. Unfortunately, the process can get stuck in the first stages, and it needs something to kickstart it back into action. That push can be exercise or even your diet.
You can almost think of it, what's good for your heart is also good for your joints. But you can change the inflammatory signal, and you can decrease chronic inflammation with these good kind of healthy fat, healthy food diets. And when I use the phrase healthy fat, what I'm referring to are things like olive oils and avocado oil and nuts like walnuts and leafy green vegetables and fruits and fish, things like that. So those are the kind of healthy fats I'm thinking of, the omega-3s and then the monounsaturated fats like olive oil and avocado oil. So those can help decrease the chronic inflammatory changes, and they can promote healing.
Our bodies use these healthy fats to create the lipids that resolve inflammation and decrease pain. And though exercise is a crucial component of kickstarting this healing process, the initial inflammation can be painful and make it difficult for some people to move their bodies. This is where steroid shots can be really helpful in providing enough pain relief for the person to start working out.
Sometimes a steroid injection, a single steroid injection, I think can be helpful to get people moving again. To me, that is the power of it, is if it helps somebody return to function, return to the gym, that's great. And the caution I share with people is that it's the repeated use of steroid injections. 1 year, one every couple years is probably fine. 4 a year is probably too many. And somewhere in between, it's a bit of a gray zone. But if that injection gets them moving again, I think that's fine. But if it's used repeatedly because they can't get moving otherwise, then we really need to start thinking about these other therapies that kind of flip that immune switch and hopefully promote that healing cascade.
In addition to steroid shots, other regenerative therapies can also help flip the switch.
You want to take their immune system and give it a stimulus and flip that switch. And that switch flip will begin this resolving inflammation process. And so it's really a booster in a lot of ways. And things will do it. Platelet-rich plasma does it. Autologous conditioned serum does it. Stem cells do it. They all help to basically turn the corner for a lot of these joints. So they may not, actually none of these therapies, none of the regenerative therapies will grow new cartilage, but they'll improve the health of the cartilage that's already there.
All while helping your body to finish its healing process. To put his research to the test, Buchheit followed this protocol after tearing his meniscus for the second time. With the first injury, he took anti-inflammatories as instructed for several months. And though it was a very slow recovery, Buchheit was able to get back to his active lifestyle. The second time around, though, he decided not to use any medications that would block the inflammation.
So no steroid injections and no anti-inflammatories. And it is true, it hurt quite a bit. It hurt quite a bit. I hobbled around for several weeks. But my recovery was faster. And I was skiing within a month of it happening. Now, again, I still had a little bit of discomfort for that month. But I was back to full sport and full activity fairly quickly. And so I think that it was a nice, it was an N of one experiment, right? And I had a similar injury 2 different times. But the second time around, my recovery was faster. And I am convinced it was faster because I let kind of those immune mechanisms turn on and do their work, and I didn't suppress them with anti-inflammatories or steroids.
Despite Buchheit getting back into skiing so soon, there was still some lingering inflammation that signaled the injury wasn't yet fully healed. Knowing he needed something to stimulate the healing cascade, Buchheit decided on autologous conditioned serum. ACS is a method that takes blood from a patient, stimulates white blood cell production, then injects it back into the injured area. It releases the proteins needed to resolve any existing inflammation.
So I had an injection done of autologous conditioned serum by a colleague and friend in Germany who does a lot of it, and who taught me to do it years ago. And I do this therapy as well, but I didn't want to do it on myself, so I had a colleague do it. And it worked quite well. I think it was what I needed to kind of flip that switch, and that was 2 years ago now.
Buchheit's book, Healing Joints and Nerves, is available now wherever books are sold. You can find more information about Dr. Thomas Buchheit and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farah.
Coming up, the prevalence of eating disorders in men when In Good Health returns.
Now, finding a doctor is a little less challenging. United Health Group is investing in tools that make it easier for patients to navigate healthcare and pay less. These transparency tools help patients find providers, and this is the big thing: compare costs up front. The big picture? More transparent pricing benefits everyone. And these tools from United Health Group can help patients save hundreds of dollars annually. Learn more at unitedhealthgroup.com/commitment.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Last week, Danny O'Connor revealed how his binge eating disorder forced him to step away from his professional boxing career. Though he faced an invisible opponent, O'Connor decided to fight it the only way he knew how.
I view it as like an athlete. Like if you got injured, you'd rehab, you'd allow yourself to heal, you'd come back, you'd be optimal. And so I view anything emotional, like physical, mental, whatever it is for the whole athlete, like we got to address this and get over it. So at that time is when I first came out and basically exercise, like understanding what supports are out there, learning more about eating disorders, seeking professional help.
O'Connor began consuming any information he could get his hands on. The first professional he felt comfortable talking to was a sports psychologist who let him slowly start acknowledging the binge eating. After years of his eating disorder going unchecked, O'Connor was scared of the damage it had done to his body.
When you really understand what a binge is, like it scared me where all that food was going. I didn't know how it was going to affect my internal organs and all this stuff, which it does. When you go against or too much or like body systems, it affects stuff, your electrolytes, like your minerals. Like I've had so many different health issues over the years because something's been affected by the eating disorder. So like it was an extremely scary time in my life. Like I didn't even know a person could eat that much food, let alone, not stopping. Like a binge is not like it's not like a comfortable place to be when your body can only fit so much. And then there's times of vomiting in between the eating. And then like, it just was a wicked, scary place. I wish I had that guy that I could sit at the coffee table with in front of me and be like, oh, dude, this is what's going on. Like, what's happening to you? Like, how is it affecting you?
Sadly, O'Connor couldn't find many other men to relate to on this journey. He was often the only man in the various meetings and outpatient programs he attended. Since 2013, he's only spoken to 4 men who've had similar experiences, despite the statistics showing that many more are silently suffering. Desperate to find a sense of community, O'Connor attended some Alcoholics Anonymous meetings to connect with more people who looked like him. It's this feeling of isolation that drove O'Connor to finally reveal his lifelong secret to the world in his new memoir, Weight Class, A Fighter's Life or Death Battle with an Eating Disorder.
If the stats are right from the national sites where they're quoting like 10 million men, I thought maybe my story could like help somebody that was struggling with something on their own. I was 14 years old when I first went into a weight class. I was a child. I was adolescent. So I thought for all those children, there's a kid somewhere in the world right now in Iowa who, is looking up to Dan Gable and wants to be a champion. And, they're going to step into a weight class sport. I thought for that population of people that don't have an eating disorder yet, that it would be like a crucial lesson of like, don't do these things because they can have irreparable harm in the future. And, because I dealt with this thing for 20 years. It's not like I had a little habit that affected a little bit and went away. It was a 20-year journey of ultimately developing this eating disorder that took over my life and almost killed me. And really, so I think it's important for early intervention.
In addition to sharing his story, O'Connor's created Bite Like a Man, a space for men to connect and talk about issues involving food, bodies, and identity. It's estimated that boys and men make up 1/3 of all people with eating disorders, but most don't get the help they need. O'Connor hopes that his story gives others the courage to face their disorders head on. Despite not having a group of men to relate to on this journey, O'Connor's wife and friends proved to be strong support systems. And after taking a year off after 2013, he felt ready to step back into the ring.
I mean, I don't think the eating disorder was totally gone. It was just in a way better spot. So I thought like the supports I was using were helping and, I was good to go. Ultimately, I wasn't because it came back really with like a vengeance for 2018 when I went to the ICU.
Despite being the biggest fight of his life, O'Connor never even made it to the final weigh-in. The more out of control his binging became, the more extreme his starvation tactics had to be. But his body had stopped responding. O'Connor pushed himself to the brink of death to try and shed pounds his body refused to let go of. The risk of organ failure was simply the most recent in a long line of health issues over the years.
When you go against all these systems of the body, they cause serious damage on the other systems, along with like, if you're overeating, obviously now you're getting all the minerals and vitamins and things that are coming in. So my health was pretty affected over the years. Like 2013, I starved so aggressively for a fight on TV that I caused myself to be anemic, which is like an iron deficiency. And I turned myself completely orange, right? And so like my hands, all my hands, my elbows, it was very visible. Like people would make comment to it. That's how visible it was. And so a lot of beta carotene. I was binge eating at one time on a lot of pumpkin and sweet potato, and it essentially turned my skin a different color.
O'Connor's binging and purging has led to so many health issues that he still has to check if any concerns today are due to that period of his life. His healing process has been a long journey of progress followed by relapses. But like a true athlete, he always kept his eyes on the prize. O'Connor continued working with professional therapists and dietitians, practicing mental wellness strategies to try and break the hold his eating disorder had on him.
And then it's kind of like just rebuilding those habits. Like, what does eating food look like for me now? Like, because it's looked like this for 10 years, but now it's not going to look like that anymore. So what does it look like? Like, now you have to build all these new habits of like, this is how I eat. This is how I don't eat, or whatever I don't make rules on my stuff now. Like I like to be healthy.
The only real structure O'Connor keeps today is to eat breakfast every day. And since he doesn't have any hunger cues, he makes sure to eat at specific times in the day so that he never misses a meal, which could trigger a binge. Despite his progress, O'Connor still keeps a few bags of frozen petite peas in his freezer, just in case an urge starts to creep up on him.
I hope that it never sneaks up on me again. I hope that I never have the action of binge eating anymore, which I don't, and that I never binge eat again. But I thought that, and then I had that relapse. So that thing kind of shook me up a little bit. So I have a healthy respect for like the whole disorder. And so I kind of live my life in a certain way, or I try to live my life in a certain way where I do all the things that are going to be the most optimal to keep me in a good spot and away from the eating disorder. Because I didn't know if you'd even be able to beat an eating disorder. I talk about my feelings for sure. I don't let anything like boil up. I try to address everything, be open and honest about how I feel and what's going on. So having the professional I work with to like talk about my feelings or talk about just whatever I want to talk about, I think is helpful for me.
O'Connor's book, Weight Class, is available now wherever books are sold. You can find more information about Danny O'Connor and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Now, finding a doctor is a little less challenging. United Health Group is investing in tools that make it easier for patients to navigate healthcare and pay less. These transparency tools help patients find providers, and this is the big thing: compare costs up front. The big picture? More transparent pricing benefits everyone. And these tools from United Health Group can help patients save hundreds of dollars annually. Learn more at unitedhealthgroup.com/commitment.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
It doesn't stop young people from engaging in social media or engaging in online activity. All it does is push what we already know is happening to a location that we can't monitor as quickly and clearly.
Viewpoints Radio podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.
Medical notes this week. The hidden weight of a brain tumor may be doing more damage than the cancer itself. A study published in the Proceedings of the National Academy of Sciences reveals that chronic physical pressure on the brain triggers neurons to begin a programmed self-destruction sequence. The compression activates an inflammatory response, a sign that neuron damage and death is coming. Researchers hope this finding will inform future treatments to help protect healthy neurons and prevent motor impairment and cognitive decline. Why are Americans still dying early? Despite major medical advancements, our life expectancy still lags behind other wealthy nations. New research points to a few issues that are holding us back, including suicides, homicides, drug overdoses, and cardiovascular disease. Experts say these issues point to deeper systemic problems in America that are shaping our health. The research is published in the Proceedings of the National Academy of Sciences. A high-fat diet may be bad for your brain. The gut is commonly known as the second brain due to the millions of neurons in the digestive tract. However, new research shows that this gut-brain connection works both ways, and may be making us vulnerable. Research in PLOS Biology shows that live bacteria from the gut can travel into the brain. This animal study revealed that a high-fat diet increases the amount of bacteria in the brain, potentially causing neurological diseases. And finally, should doctors be writing prescriptions for exercise? New cancer research shows that chemo patients who stayed active were mentally sharper compared to patients who did not. With up to 75% of cancer patients reporting cognitive difficulties from their chemotherapy treatments, exercise could be an effective tool in combating these negative symptoms. The research is published in the Journal of the National Comprehensive Cancer Network. And that's Medical Notes this week. I'm Mayan Voss.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Finding ways to be financially savvy is a smart move, and knowing you could be saving money for the things you really want, like that dream home or new ride, is a great feeling. That's why the State Farm Personal Price Plan can help you save when you choose to bundle home and auto. Bundling, just another way to save with the Personal Price Plan. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.